Assalamu alaikum. Bismillahirrahmanirrahim. In this video, we are going to discuss about the Norma Frontalis. Norma Frontalis is roughly oval in appearance. Following 8 bones take part in the formation of Norma Frontalis. First of all, frontal bone, then right and left maxillary bones, right and left nasal bones, right and left zygomatic bones, and then mandible. We will discuss Norma Frontalis in under 4 headings. First of all, frontal region, and then orbital openings, then anterior bony aperture of nose, orbital open frontal bone, and then orbital opening, then nasal aperture, and lower part of face. And then we will discuss about the attachments of muscles and ligaments on the Norma Frontalis, sutures which are present on the Norma Frontalis, and then structures passing through the foramina which are present on Norma Frontalis. First of all, we are going to discuss about the frontal region. This is frontal bone. This is frontal bone. The upper part of frontal bone is smooth, forming the forehead, and the lower part is interrupted by orbital openings, and in this way this part is rough. We removed the scalp, and we will discuss about frontal region. In the frontal region, we will see 4 things. First of all, this is superciliary arch. This is rounded and curved elevation. Curved elevation is rounded and curved elevation above the medial side of the orbit. It is better marked in females, this elevation, and children than in males. And next to superciliary arch is the glabella, the point at which the superciliary arches of right and left side meet. This point is called glabella. Beneath this glabella is a point which is called nasion. Nasion is a point at which frontonasal suture, this bone is frontal bone up to this extent, and this is nasal bone. Frontonasal suture, frontal bone and nasal bone meets, and internasal suture, right nasal bone, and this is left nasal bone. These these nasal bones meet at internasal suture, and when internasal suture meets the frontonasal suture, this point is called nasion. Fourth point is the frontal tuber or eminence. Frontal tuber is a point, a small rounded elevation at this point, and right and left points. This is called frontal tuber or eminence. These points are more prominent in females and children rather than in males. We will discuss about the orbital openings. Each orbital opening is bounded by 4 margins: supraorbital margin, infraorbital margin, medial orbital margin, and lateral orbital margin. Supraorbital margin is formed by frontal bone. This is frontal bone, and at the junction of medial 1/3 and lateral 2/3, this point is called supraorbital notch or supraorbital foramen. Next to this is infraorbital margin. Infraorbital margin is formed by zygomatic bone laterally. This is zygomatic bone. This up to this zygomatic bone, and maxilla. This is maxilla. This is maxilla. Infraorbital margin is formed by zygomatic bone and maxilla, and medial orbital margin is ill defined. It is formed by frontal bone above and frontal process of maxilla. This is maxilla, this is frontal process of maxilla. And the lateral margin is formed by frontal process of zygomatic bone. This is frontal process of zygomatic bone and zygomatic process of frontal bone. This is suture, which is called frontozygomatic suture. Now we will discuss about the anterior bony aperture of nose. Third heading, anterior bony aperture. It is pear-shaped, being wide below and narrow above. It has boundaries. It is bounded above by two small nasal bones. This is one nasal bone and this is other nasal bone. And above it is bounded by two nasal bones, and below it is bounded by nasal notch of maxilla on each side. This is nasal notch of maxilla on each side, and it presents the following features. The lowermost point of internasal suture is called rhenion, this point, and below this opening, this bony aperture, this point, this elevation is called anterior nasal spine, this elevation. And nasal aperture articulates in the following way: anteriorly with the opposite bone at internasal joint. This is anteriorly. Each nasal bone articulates with the opposite nasal bones at internasal suture. Then posteriorly, each nasal bone is articulates with the frontal process of maxilla. This is maxilla, and this is frontal process of maxilla. And superiorly, it is articulates with the frontonasal suture. This is frontal and this is nasal, frontonasal suture. And then inferiorly, the upper nasal cartilage attaches at this point. In this way, it articulates with the upper nasal cartilage. Nasal bone is most commonly fractured bone of the face. It commonly fractures at this point, at the middle of the nasal bone. Now we are going to discuss about the lower part of face. In the lower part of face, first of all, we will discuss maxilla. Maxilla contributes large share in the lower part of face. This is maxilla of one side. Medially it presents the nasal notch. This is nasal notch and anterior nasal spine. This is anterior nasal spine in the median plane. And the incisive fossa above the incisor teeth. Above presents the incisive fossa, and the canine fossa lateral to canine eminence. There are 4 processes of maxilla, out of which 3 processes are seen in the Norma Frontalis. First process is frontal process, and then zygomatic process, which articulates with the zygomatic bone, and the alveolar process, which presents sockets for the teeth. In addition, zygomatic bone, also called molar bone, also present, and this is zygomatic bone. This is the frontal process of zygomatic bone, and here it articulates with the maxilla. Zygomatic bone presents zygomaticofacial foramen. This foramen is called zygomaticofacial foramen. And then we will discuss mandible. This is mandible or jawbone. This bone is only bone which is movable in the skull. The upper margin of the upper border of the mandible presents sockets for the teeth, and this is point is called where to right and left half of the mandible joint symphysis menti. The lower border is also called base. The middle point of the lower border is called mental point or gnathion. This is the angle of the mandible. This point is called gonion, and the anterior surface presents mental foramen and mental protuberance and oblique line. This is oblique line. The further explanation of the mandible is explained in the separate video of mandible. Now we'll discuss about the sutures which are present in the Norma Frontalis. First of all, internasal suture, two nasal bones joined and joined at internasal suture, and then frontonasal suture, frontal and bone and then nasal bone. This is frontonasal suture. Nasomaxillary, this is nasal bone and this is maxilla. This suture is called nasomaxillary suture. Lacrimomaxillary suture, this is the lacrimal bone, short bone. This is short lacrimal bone, and this suture is called lacrimomaxillary suture. And then frontomaxillary suture, this is frontal bone and this is maxilla. This is called frontomaxillary suture. Then intermaxillary suture, this is intermaxillary suture. And zygomaticomaxillary suture, this is zygomatic bone and this is maxilla. Zygomaticomaxillary suture, zygomaticofrontal suture. This suture is called zygomaticofrontal suture. And we will discuss about structures passing through the foramina. On the above, this is supraorbital notch or foramen. Through this supraorbital nerves and vessels pass, and then infraorbital foramen. Through infraorbital foramen, infraorbital nerves and vessels pass. Zygomaticofacial foramen, through this foramen the nerve of the same name and the maxillary nerve, a branch of maxillary nerve also pass through this foramen. And then mental foramen, through mental foramen mental nerves and vessels pass. And now we will discuss about the attachments on the Norma Frontalis. First muscle is corrugator supercilii muscle, which originates from the upper side of superciliary arch. And then procrius muscle arises from the nasal bone, medial plane of the medial surface of the nasal bone. From this surface, this is the procrius muscle origin. Now we will discuss three muscles which have almost similar origin. First of all, orbicularis oris. This muscle has two parts. First part is orbital part and second is medial palpebral part. Orbital part originates from the frontal process of maxilla through this point and the nasal part of the frontal bone. This muscle is round in this shape, covers in this the orbit, and the palpebral part originates from the point which is present between this point and this point. And third muscle is levator labii superioris iliaci muscle. This muscle also originates from the point between the frontal process of maxillary bone and the nasal part of frontal bone from this point. And then fourth muscle is levator labii superioris muscle. This originates from the maxilla between infraorbital margin and infraorbital foramen. From this point the muscle superior levator labii superioris muscle originates, and then levator anguli oris muscle from the canine fossa. This is canine fossa. From this point levator anguli oris muscle originates, and the nasalis and depressor septi muscle originates from the surface of the maxilla which bounds the nasal notch or foramen. The incisivus muscle also originates from the point of origin of depressor septi muscle, and then zygomaticus major and zygomaticus minor muscle originates from the zygomatic bone. This is zygomaticofacial foramen. Below this foramen, from this point, zygomaticus minor muscle originates, and lateral to this zygomaticus major muscle originates. And the last muscle is buccinator, which originates from the maxilla and the mandible. This is maxilla and mandible. Opposite side of molar teeth. From the opposite side of molar teeth, this muscle have two regions. It also forms part of orbicularis oris muscle. In this way, the norma frontalis is completed. If you like the video, then subscribe our channel and share to your friends. Thanks for watching.